think we'll go ahead and get started. I'm sure some other people will be joining. Again, I want to thank everybody for joining. My name is Dario Camplatero. I'm the Managing Director for Hill Group Mid-Atlantic. I want to welcome everyone to this event, Stepsisters Step Up Your Health webinar. Excited to be part of this program and participating with this great panel that we have today. And for many of the people on this line are familiar with Stepsisters, and some that you may not be familiar. They do a tremendous amount of work in the region and raising funds and really delivering services for patients in treatment, actively in treatment. Really phenomenal work that they provide in life and crisis support. So I really want to thank them for putting this on today. Today we're going to be discussing and staying committed to and motivated on your fitness journey, supporting your overall health as it relates to cancer prevention, as well as during health challenges. So overall, just really staying focused on that. We're going to be hearing from two-time breast cancer survivor and endurance athlete, Denise Kloppel, and hepatology and oncology specialist and recognized expert in the fight against breast cancer, Dr. Amy Irwin. Last but not least, allow me to introduce our moderator this afternoon, Kristen Berset-Harris. Kristen is an award-winning host of The Great Day Washington on WUSA. Each weekday morning, Kristen interviews everyone from celebrities, journalists, musicians, chefs, local people, making a big impact in their community. Prior to joining the Great Day Washington team, Kristen spent 6 years at WUSA 9, sports anchor, covering everything in the DC area sports teams had to offer. In June 2017, Kristen received the Ted Yates Award from the National Capital Chesapeake Bay chapter of the Emmy Awards. It's the Chapter Profile of Courage Award given to professionals in the news business who have exhibited bravery on and off the job. Kristen returned to WUSA 9 in August 2017 after completing treatment for her second bout with breast cancer and continues to be a strong advocate for awareness and early detection. Kristen is a graduate from University of Florida with a degree in telecommunications and continues to be an avid Gators fan. So thank you, Kristen. I'm going to turn it over to you.
Sounds good. Thanks so much for having me. Hello, everybody. Thank you all for being here. What an important topic we are talking about. As it was mentioned, I'm a two-time breast cancer survivor. I'm about 3 years out now from my second go around. The first time I was 27 years old when I was diagnosed, and then I was 36 years old the second time I was diagnosed. So thankfully, both times I caught it early, did self-breast exams, was just on top of my health, and was surprised, but the best outcome possible because I caught it early. That's why I'm such a big advocate about breast health education and early detection. So I love that we're talking today about our health and fitness when it comes to breast cancer before, during, after diagnosis. It's something that we struggle with all the time. I struggle with it now, just figuring out what this kind of new normal is. And I know, especially being in quarantine, it's been a little bit different during a pandemic to keep our health up, but it's so of the utmost importance. So I'm excited to hear from our panelists today, and then we will take some questions. Some of you already submitted questions when you registered, so we will dish those out to our panelists, and then time permitting, we will take some questions. So if you have something that comes up when one of our moderators is speaking, then please put it in the chat, and we will get to as many as we can. But a big thank you to the Stepsisters for putting this together, and we're excited to get going. So I want to introduce to you our first panelist. Denise is going to share her full story with you, but just the nuts and bolts. You should know that Denise Kloppel is a retired colonel in the U.S. Air Force. She was a master air battle manager with 2,900 flying hours in the E3 Airborne Warning and Control System and E8 Joint Surveillance Target Attack Radar Systems. After 9/11, she deployed as a squadron commander to Qatar in support of Operation Iraqi, Operation Enduring Freedom. Now, Denise's greatest passion is training and competing in triathlons, half marathons, and marathons. And check this out, she's finished more than 15 70.3 triathlons. Truly amazing accomplishment. Denise has battled breast cancer twice. First in 2015, And her most recent diagnosis was actually in July of this year. Denise's military training and endurance sports athleticism have provided her with the tools to tackle this diagnosis. And along with her personal story, she is going to share several key things that she found that were so critical during her for her well-being as going through cancer. So Denise, I am going to turn the floor over to you.
Well, good afternoon, and thank you, Christine, for that lovely introduction. I would also like to thank stepsisters for their support during this treatment. I felt very blessed and fortunate to have them on my side as we progress, especially during this pandemic and this quarantine. As Kristen said in my intro, I'm an Air Force veteran that served 26 years. I retired in 2009. Since then, I've been spending a lot of time as a volunteer with the USO at Dulles and my church. And I also was volunteering with my therapy dog Sport, visiting rehab centers. But truly, most of my time has been spent training for the endurance sports. In 2011, I decided that it was time for me to try to tackle a full Ironman. Full Ironman distance is a 2.4 mile swim, 112-mile bike ride, and a 26.2 run. Yes, all in the same day. In 2013, at the age of 52, I completed my first Ironman. And as I crossed the finish line, my husband was there and he saw a smile on my face and he said, "You're going to do another one, aren't you?" And I said, "Absolutely." And so we continued to train. And in 2014, I again finished my second Ironman. In 2015, I signed up for my third Ironman in Canada. But prior to that, in May, I had my mammogram, which coming from a military background, there was just some certain things we always did, and we learned to take care of ourselves and making sure we always got our annual exams and a physical every year. And so this was part of my schedule of always taking care of myself. It was at that time that I got diagnosed with a mass in my left breast. And through further testing and biopsies, it was determined that I had triple negative breast cancer in my left breast. Being an endurance athlete, what do you think the first thing was that I was concerned about? Yes, I thought to myself, I'm not going to make the Ironman in August, am I? And the doctor said, "No, you're not." And I said, "Okay." So we regrouped. I did the trifecta of treatments that time, the neoadjuvant chemo, the lumpectomy, and the radiation. I continued to train, cycling and biking mostly during that time. And I was able to culminate my treatment and training at the same time with finishing the Goofy Challenge in Walt Disney. On Saturday, I ran a 13.1 mile marathon, and then I ran a 26.2 mile marathon on Sunday, got on an airplane, and finished my last radiation on that Monday. Probably not always the smartest thing to do, but that was the way that I kept my balance in my life. Since then, I've continued to train. I've completed 2 more Ironmans, and I completed 11 70.3s plus 2 marathons last year, doing the Marine Corps Marathon. I was again on a watch, and so I went in for my mammogram, and this is one of the critical things you need to take from this. I was in, and I had a mammogram in May of 2020. There was no indication of any disease. I thought I had the magic fairy dust sprinkled over me, and I was all in the clear because it was almost 5 years. In June of that same year, I actually did a little bit of an exam, and I actually was the one that found the lump in my left breast again. Since then, again, through further diagnostic and testing, it was determined that I had triple negative breast cancer in my left breast. I just recently started chemotherapy. I've had 2 sessions. Tomorrow's my 3rd. I feel like a rock star, so I know it's time to get back into the infusion chair. But I continue to run and bike during this treatment also. What I learned in my endurance training and in my military training and with the cancer treatment is I had to focus on what I can control and what I couldn't control. And so what I had identified is my core blocks that give me balance. And I relied on some of my endurance training and military training, again, to be physically fit. You know, we always had to be fit in the military, and I had to be physically fit to do this in endurance sports. And so I really have a philosophy that endorphins are my drug of choice. I love endorphins. I love the fact of what the endorphins do for me, from a positive attitude to a motivation. And so that's why I continue my fitness program throughout my treatment. To the extent possible. I do have down days, and sometimes that's just basically walking the dog. The other thing that was critical that I learned during endurance that I applied to my, again, cancer treatment is nutrition. You know, we have that same philosophy, garbage in, garbage out. So basically, I always evaluated my nutrition prior to my training, always trying to make sure that I was getting the right balance of protein and carbohydrates and hydration. And that's what I do now during my cancer treatment. I take a look at tracking certain elements to make sure that I am on the best nutrition plan, eating clean as much as possible, staying away from sugar as much as possible, trying to eat plant-based as much as possible, all of the things that I try to do to maintain a good nutrition in order to maintain my physical health. My fourth building block, of course, is my faith. Sometimes, you know, you just can't be physically fit or nutrition, and so I rely on my faith to carry me through those moments. And I just have a firm belief in, like, taking the time to have some quiet time, whether that's meditation or prayer time, and then just starting the day with a gratitude list. I mean, again, you know, there's just so many things in this world that I could focus on that's negative, but I have so many blessings in my life that I can focus on that's positive. And I just go through that list in the morning, and I did it this morning. And, you know, one of the first things I said, what a gorgeous day, right? What a gorgeous day. And my fourth balance block is mental toughness. And I think some of that stuff is just things that I have learned through my career and through my life. And, you know, we talk about just having the capability, and I call that like grit. I mean, there are days I don't want to get out of bed, but, you know, there are always days that, you know, in my life that I had that challenge. But, you know, who at almost 60 years old wants to get out of bed at 5 o'clock in the morning to go to swim practice? You know, that's for the teenagers, not for us older, or for me, you know, but I get out of bed and I went to swim practice at 5 o'clock. So it's just that mental toughness of get on with getting on. And during races or cancer treatment, sometimes it's just a matter of putting one step in front of the other and just keep moving forward towards that finish line. And that's kind of the mentality that I have. So those are my span of control blocks that I rely on in order to, you know, keep me balanced during cancer treatment or endurance sports. And then there's also just, you know, the bottom line is sometimes, you know, these things just are out of balance, and I do the things that I did in my long endurance races. And that means that I just take the focus off myself and I focus on what can I do to help other people, whether that's saying thank you to the volunteers that are on those race courses for 14 and 15 hours, or encouraging some other racer that's having a tough day, or just, you know, again, you know, kind of like, that's what I do with my cancer, because I ask my village, I'm like, you know, I just go out and I thank them. I send them thank you notes for everything that they do for me. And then the last thing is, you know, sometimes you just have to keep your sense of humor. You know, for me, that's just something that I think about. As a matter of fact, I just had a discussion today, and I'm like, I have a really dilemma for Halloween, because now I'm either deciding between Mr. Potato Head, Mr. Clean, or Uncle Fester. And so it's a real big dilemma right now that I'm struggling with. So I just want to thank everyone for allowing me this opportunity. And again, you know, be grateful, be strong, and be positive. Thank you very much.
Denise, thank you very much. Thank you for your service. Thank you for your strength and your courage. Maybe our participants in the chat can decide what you should be for Halloween. Help you out there on that decision. I love that. Sense of humor is so, so important. Remember, if you have any questions for Denise or our upcoming panelists, or any of us, please just type it in and we'll try and get to as many as we can. All right. The next panelist I want to introduce you to is Dr. Amy Irwin with Virginia Cancer Specialists. Dr. Irwin's commitment to caring for and treating oncology and hematology patients led her to join the Loudoun office of Virginia Cancer Specialists in 2008. She is a member of the American Society of Clinical Oncology and is a national clinical trials researcher. Dr. Irwin regularly lectures in the community for Life with Cancer, has educated the public on clinical trials for the Leukemia and Lymphoma Society, and has given multiple physician grand rounds at Inova Loudoun Hospital to educate her peers on current oncology and hematology cases and developments. She is a recognized expert in the fight against breast cancer. Dr. Irwin is part of the National U.S. Oncology Breast Cancer Research Committee, has been interviewed as a breast cancer specialist on television and in magazines, and is repeatedly called on to speak at charity events for breast cancer awareness and prevention. Awarded multiple commendations for outstanding patient care, Dr. Irwin has a longstanding commitment to providing the best outcomes for her patients. And Dr. Irwin, we are so honored to have you here today to speak with us. So I'm going to give you the floor.
Thank you so much. And I want to start by saying an enormous thank you to all of the people who made today possible. The breast cancer survivors who are participating in this program, Kristen and Denise, and the stepsisters who have brought us together. One of the things that I was saying to someone very recently is how special the stepsisters are. And because you're here, you probably already know this, but it's worth mentioning the impact that the stepsisters have on our local community. This charity has been so impactful within my practice in helping our patients really take care of the practical needs that they have. Outreach like this is an amazing opportunity to get messages out to the community, and I couldn't be more grateful to be here with you today. And having said all of that, I'd love to get into my presentation. Certainly exercise is an incredibly important component of survivorship, but I also want to intersperse my talk with some other really practical tips from a lifestyle perspective. I'd like to give some actionable goals, and then I'd like to close with some ways that we can all look forward together. So for the first part, prevention. This is something that we all know, but it's hard for all of us to remember, right? You know, it's that whole apple a day. But especially in these COVID times, which are so unusual, I'd like to remind us all, including myself, that sedentariness is not our friend. Activity is our friend. We know that sedentary activities, based upon well-done clinical trials, show a 22% increase in all-cause mortality, increased death, 14% increase in cancer-specific mortality, 15% increase in cardiovascular heart deaths, and finally a 91% increase in type 2 diabetes. Specifically for our group and our discussion here, we know based upon excellent trials that women who get regular exercise, are very active, have a lower risk of breast cancer than women who are not. When the evidence is looked at as a whole, regular exercise appears to lower breast cancer risk by about 10 to 20%. The benefit is seen across all ages, but in particular in postmenopausal women. The American Cancer Society recommends to all of us 150 minutes, about 2.5 hours total per week of physical activity as a goal to lower our cancer-specific risks. And it doesn't mean we have to suddenly do Ironmans and ultra marathons. I wish that was possible, but it does mean we need to start where we are and to build upon that, to get those blocks that were presented earlier and really line them up and get that going. Specifically to that, we need to get other lifestyle things in line too. We need to watch our alcohol. We need to moderate our diet. In 2014, all cancers that occurred, 40% of them were attributed to obesity as a risk factor. We also know that weight at time of cancer diagnosis is incredibly significant for outcomes. So the more that we can all pre-position ourselves for success, the better we'll do. We know that women who are morbidly obese before beginning chemotherapy had a 60% increased risk of recurrence in one trial. For women who are just a little bit more overweight, BMI not greater than 35, but greater than 30, that recurrence risk was 20%. So these are big impact numbers. So I'd encourage everyone, myself included, to take an inventory of where we're at and what small changes can we make today to get to our goals of being best positioned in case, unfortunately, cancer strikes us. Now, the second part that I've been asked to address is what to do during treatment. What evidence is there for exercise and lifestyle modifications or choices to help power through health crises? And as I'm looking out on the Zoom participants, I may or may not see some friendly names and or friendly faces. And some of this might sound a little bit like a broken record, but please bear with me. The first is doing what you can. We know the American College of Sports Medicine does strongly recommend exercise during treatment. It will decrease fatigue. And paradoxically, when you're tired is when you need to incorporate exercise. It will increase flexibility. Exercise will improve mental health. And exercise will help dampen the effects of chemo brain. And I know you ladies know what I'm talking about with the chemo brain. It's real and we can help mitigate it through exercise. Exercise also boosts the body's immune system, and that has a beneficial effect from slowing the growth of cancer, improving the efficacy of chemotherapy, and also long-term cancer-related consequences. As a woman goes through her cycles of chemotherapy, there are going to be good days and bad days. We all know that. So adapt what you're able to do to where you are in your cycle. Do any activity that makes sense during that time. For example, maybe just going outside and doing some gardening, getting some sunlight. Maybe taking the stairs if you're having a great day. Maybe it's a walk with your friend or a walk with your dog. Maybe it's parking a little further from the building. Maybe it's stretching during lunch. Maybe it's just tracking your steps and having a little bit more mindfulness and awareness as to where you're at and seeing how you can modulate that over time. And during those dreaded Zoom calls, but absolutely not this Zoom call, you can do things like an under the desk elliptical, an under the desk bike while you're kind of zoning out a little bit. Standing desks, treadmill desks are all ways that you can add little bits of intensity as you go along. Other lifestyle changes, I'd be remiss if I didn't talk about diet and hydration as adjuncts to power through. We know that chemo alters the sense of taste and smell. We know that nausea begets dehydration and you get in a vicious cycle. But whatever you can do to improve those through small common sense steps, I would highly encourage you to do. And as a thank you, I'd like to mention the Stepsisters pop-up farmers markets that are currently in my office that have fresh produce delivered to our patients who are on treatment where they're at. So in one outing, they can get their chemo, but they can also get healthy food for the week. It's been incredibly popular, and it's one of those practical things that I mentioned that are so impactful that the Stepsisters brings to our community. Now, in our remaining small amount of time, I'd like to pivot towards survivorship because I think that's also very relevant for many of the people on this call. There are three things that I say to all of my patients, three key take-home points. For breast cancer specific mortality, to live longest despite your breast cancer, I encourage my ladies to do these three things. Number one, you guessed it, activity. 90 to 120 minutes per week counts towards improving the longevity for a breast cancer survivor. Whatever gets your heart rate up counts towards that goal. Number two, moderation of alcohol. For a woman, that's less than 1 alcoholic beverage per day. For a man, that's less than 2. So if it's a celebration and you have 2 drinks, that's okay. But then back off for a couple of days so that the average remains less than 1 per week. And then working towards and hopefully achieving a normal body mass index. We know that activity connects the body and the brain. We know that depression and quality of life improve. We know that sleep improves. And we know that for survivors, there are many opportunities to engage in activity. There's the STEP challenge that the Stepsisters are currently hosting this month, which is excellent. They're also partnering with Walk for Mountains to have additional exercise programs going on. Work companies often have group goals. You could try for streaks. You could do a recreational sports team. You could do a charity event. Whatever gets you motivated and gets you moving. And so in summary today, Exercise, along with other lifestyle changes, are critical components of a holistic breast cancer strategy, both prior to diagnosis, during treatment, and for long-term survival. Exercise causes profound physiologic changes in the body that we can tap to and use to our advantage. We're just beginning to understand this. And I encourage you all to remember, it's never too late to adopt a healthy lifestyle. So thank you for this opportunity, and I look forward to answering your questions later in this webinar.
Dr. Irwin, thank you so very much. With all of those, it's just the inspiration to just get up and get moving. As Denise said, sometimes she doesn't feel like getting up. Maybe it's just walking the dog or taking a call on your phone, just getting moving, and then it compounds and you're feeling better and able to do it. I know a lot of us sometimes don't want to go out there, don't want to get moving, but just a little something. I try and take the steps at work and not the elevator to go like 2 floors. So trying our best.
We're all doing our best.
Yeah, whatever we can do. So we've got some questions that you, our registrants for this seminar, submitted early on. But again, put it in the chat if you've got something else to be asked. And Dr. Irwin, I was going to start with you. You kind of touched on most of this, but about the importance of exercise with breast cancer diagnosis. Can you expound a little bit on how it combats the fatigue, the cancer-related fatigue that we feel, whether it's just because our hormones have changed, it's chemo, it's radiation, it's just stress of what's going on?
Yeah, absolutely. Thank you for that question. I think Denise really put it best earlier in the talk when she said she was an adrenaline junkie, right, Denise? And truly, by getting the body moving, by getting the body pumping, you are creating on the cellular level physiologic changes that improve mood, that improve cognition, endurance, and create new things in the body, changes in the body that you can't get in other ways. So it cannot be overestimated, the physiologic impact of exercise during breast cancer treatments. It's medicine.
It is medicine for all of us. Thank you. I'm writing down a question to get to later. Denise, going through treatment then, going through treatment now, I mean, you touched on some good days, some bad days, but what are your biggest barriers to exercise during treatment?
I think the biggest barrier is kind of the psychological acceptance that I'm not going to be at the fitness level I was before treatment. I mean, I just really have to be accepting of the fact that, you know, if I'm my miles per minute on my run, you know, it's not right now. I've changed my philosophy and I didn't go for how fast am I going. I'm like, am I maintaining the level of endurance that I want to keep, you know, and just being a little bit more kinder to myself in that respect. And the fact that some days it's just about like, okay, you know what, some days you just go out there and you're like, this was not the best workout, but I was still out there and I was still doing it. So, I mean, that's been kind of just an awareness that, you know, this isn't 6 months ago when I was in the height of training before the pandemic, you know, kind of thing. And just going, yeah, that wasn't the best run I did or the best bike ride, but I was on my bike for an hour and a half. So, you know, that's good. Just doing it is most important to me now, not how fast I'm going or how much power I'm putting out. It's just doing it.
Dr. Irwin made a good point, just counting your steps, right? When I am working in the office with my manager, she got the little Fitbit thing to put on her wrist, and we'll just be in the middle of a conversation, and it could be about work, it could be personal, and it'll go off, and she will just say, come walk with me. I got to get my steps in. And because of COVID, we can't walk all the places that we used to, but we grab our masks and we'll walk down the couple flights of stairs. And even if it's just doing circles around the cubicles in the empty office that is on our floor, but just to make sure she gets her steps in, and she does it fast just to get a little bit of a heart rate up a little bit. And then you feel like you've accomplished something. Dr. Irwin, you agree with that? Like you feel like maybe just that little bit, you accomplish something, you get the adrenaline going, you're a little more clear when you get back to your desk, and then maybe that motivates you to do something later on in the evening.
Kristen, I couldn't agree more. It's about building on those small wins. It's about lifestyle. It's about sustainability. It's about starting where you are and having your good days and your bad days, as you and Denise talked about, and just keeping that momentum moving forward, keeping that positivity. For all of us, it's just literally one day at a time, and that's okay because we get to try again the next day, right?
I love it. I love it. All right, this next question was actually for me, but Denise, maybe you can also expand on this when I'm done. The question is, did you approach your second breast cancer diagnosis any differently than the first time around? I mean, in short, yes. The first time I was diagnosed, I was 27. I was single. I was just focused on my career. I just moved to Baltimore from Florida. So thankfully had some great medical experts to take care of me. I was actually misdiagnosed twice by a radiologist back in Florida. I was told I just had a cyst and to stop drinking so much coffee. I'm sure many of us have heard that one before. Until I went in to get my cyst checked out, and it turned out it was breast cancer. No family history, no gene. The parameters were just not there, the things that I needed. So yeah, I approached that differently because it was, all right, let's get this done. I got a bilateral mastectomy, didn't want to deal with it again. Thankfully, I caught it so early, I didn't have to do chemo or radiation, and I opted not to. And I got on with my life, right? I already felt bad enough that I was missing work, which is awful to think, like, we're going through this, but I'm worried about everybody that's having to pick up the slack at home or at work. The second time around was a little different. I was actually diagnosed a month before my wedding in November of 2016, got married at the end of the year in December, had my lumpectomy in January, and started radiation that April. And so, yes, that was a little bit different because we thought about fertility. I had to weigh the options of whether to do chemo or not. Thankfully, I still caught it early, but it was a recurrence. And I wasn't sure, if chemo was going to give me any better chance of it coming back. I just got married. I had 2 stepkids. I, was on short-term leave from work. It was a totally different time. It was scary, just as it always is. But I knew deep down, I think mentally, I approached them both the same. I knew that I could get through it. I knew I was stronger than, sometimes I felt, right? So physically, maybe approached it a little bit differently, but mentally it was another like, all right, let's get it done. Let's do this. My husband had just been let go from work as well, a couple months after my diagnosis. But what I learned from the first time and this time was finding the positive in it all, right? So he wasn't working, so he could take me to treatment in Baltimore because I got proton radiation. He took me every single day. He was there for me all the time. So as newlyweds, it wasn't really what we wanted to go through, but we got to have this quality time together. It also gave me the courage to go after the job that I have now, the job that I want. I was unhappy in the job that I was, and I saw this opportunity to host Great Day Washington come up, and I emailed the executive producer and said, hey, can I throw my name in the hat? Can I come audition? So I went to radiation treatment, and then I went to my audition, and it just felt right. And so you see this second time as being diagnosed as a catalyst for this new, incredible, happy place in my life that I am, because I wasn't going to let the cancer dictate what my life was. I let it push me, and I let it nudge me towards these open doors. And yes, we all still deal with it, right? Anybody that's on this call that's gone through it deals with the new way that your body is feeling and the fear that it can come back. But I try so hard each and every day, as Denise mentioned, to be grateful for the things I do have in my life. And it has pushed me into this happiness that I never knew was there. So That's my answer to the question. Denise, do you have any insight to that? Did you approach this differently from the first time to the second time?
Well, thank you, and thank you for your sharing your story and your courage and your determination and a positive attitude. I mean, I think that's just so critical. I have to totally agree with you. I mean, you know, you have to be grateful, and again, it does change you as a person both times, and it gives you an opportunity to either kind of step up to the plate and be grateful for the chances you have to continue to pursue the dreams that you want, or you don't, you know, you just don't do that. So. I would say that the biggest difference this time was a little bit of the pandemic. That was a little bit more of a challenge to deal with, but mentally we were moving forward. We had plans to move to North Carolina. We had a drawing of a house we were going to build, and that's the biggest difference. Last time we were kind of here, and it was kind of, okay, well, we're here, and we'll just kind of, this was considered a speed bump, you know, or a pause, and it was like, okay, that's okay. And then this time it was like, wow, you know, we were going. We were like months away from leaving this local area. And, you know, I'm kind of grateful that it happened when it happened, that we did not take that step forward, you know, just for the opportunities of all that's around us and the support structure I have. So I think that was probably the biggest challenge this time, you know, is like you, I kind of went into this with like, well, here we are again. Okay, let's get on. Let's get on with getting on. Let's get into treatment. Let's get in the infusion chair. Let's do all the things we need to do, because this is what we do right now. And then, you know, so now I'm a little bit more, you know, and it, you know, I think the biggest thing that the cancer treatment and cancer diagnosis is, you know, from a planner and a type A and a control-free personality, it has taught me to be focused on the present, to be more focused on people than tasks, appreciating relationships more than getting my floors cleaned, you know, and just kind of taking the opportunity of, you know, time, right? Precious time, and how important it is to be with people and giving people your time. So that has been tremendous for me. Thank you.
Denise, thank you. And you mentioned especially during this time, and, you know, usually we're getting together with our friends, or we're getting together for like the Stepsisters Ribbon Run, all these big fundraisers where we can all come together and support each other. And of course, this year is quite different, but it's, you know, we're grateful that we can do things like this and come together and know that there's still a village out there to help each and every one of us. There's still organizations like the Stepsisters. There's still doctors like Dr. Irwin that are there to help us and guide us through this. Even if we can't hug, or we can't, you know, high five each other, or be close to each other, there's still that support system out there for all of us. And I think that's just so, so important to remember. Another one of our questions is, again, for you, Denise. I'm going to come back to you. You talked about your fitness level. This question is, do you feel like your fitness level going into your first diagnosis was served as prehab for you, giving you really that added strength to fuel the health challenge?
You know, absolutely. But I also want to comment on Dr. Irwin's approach. You know, I was blessed to have the opportunities to train at the level that I'm training at, right? And I'm not in the top. You know, I'm not one of the winners. You know, I watch some of the people in my age group, and I see the times that they're doing. So for me, it's not about winning. It's about participating and doing the best that I can. And I would like to caveat on Dr. Irwin. I mean, it's not about using me as an example, going, well, she does these marathons and runs 6 miles and does all that. It's not about that. It's about getting up and getting moving. You know, it's about walking around the block. You know, for me, this is what worked for me at this level of fitness, but I totally agree with and totally support Dr. Irwin's approach of, it's not about running a 5K. It's about getting up and walking, or getting up and you know, taking advantage of maybe a stationary bike, or just moving, you know. And I think these fitness watches, now I have one of this high end, you know, of course it's, you know, for, you know, tells me everything, but It does, you know, a Fitbit on Amazon, a Fitbit type on Amazon is like $19.99, and it's a great accountability tool. It's so great. And then you hit your goal and you're like, woohoo, I hit my goal today. Yay. So whether it's 5 minutes or 10 minutes walking outside or 5 miles or 10 miles, I think it's just all about, you know, getting up there and getting moving. Because I do think it's been instrumental. Like I don't know if I can even say this, but I'm thinking, you know, cancer treatment is not for, it is tough. I mean, it's not easy. It is not easy for even being fit. So I could not even imagine not being fit and going into this, because it does. It'll take the wind out of your sails for sure. So yes.
So the best health we can be in, the better going into it. I think what's been great about this pandemic is all of these fitness classes and videos, that because everybody's doing it virtually. So we have access. If you need accountability and you can't, if you're like me and you usually have to have a class and somebody guide you, you can't really do it on your own and stay motivated. It's all at our fingertips now, and we've all figured out how to utilize it. So it's all there for us to use and just to be in our healthiest state that we can. Dr. Irwin, our next question's for you. They ask, what are the top 3 things you would recommend to someone who feels nutritionally and physically fit, but contracted the disease anyway at a young age and wants to lower the risk of a recurrence?
Thank you for that question. That's one of the tougher questions that I get in my office. I practice, my practice has many, many, many young breast cancer patients. The average age is 62. Most of my patients are in their 30s and 40s. Of course, I have older patients. My youngest patient ever was 23. And I only mention that because I often have amazing women who have made great choices, yet they're still in my office and we're still talking about chemotherapy, fertility preservation, who's going to watch their kids during treatment, and all of those things. And I think it's humbling. The more you learn about something, the more you realize you don't know about things. So for example, 20 years ago, we knew about BRCA1 and BRCA2. Those were the gene mutations that were associated with increased breast and ovarian cancer risks. But now when I have a newly diagnosed patient who meets criteria for genetic testing, we're not testing 2 things. We're testing 20 to 80 different cancer-associated genes. And even then, sometimes we don't understand. So I don't really have an answer for this question. Why does the person who does everything right still get cancer? It's one of those deeply unfair things. However, you gave me an out in the question as well, which is, when it happens, what can we do, right? We can't control it happening, but we can look forward and control what we do from there. So that goes to the 3 points that I mentioned earlier under the survivorship part of my presentation. Number 1, activity. 90 to 120 minutes per week. It counts if it gets your heart rate up. So start where you are. You know, what Denise is able to do and what someone else is able to do are going to be different, but they still need to do those number of minutes because that affects breast cancer mortality, death from breast cancer. Number 2, moderation of alcohol. Not so popular during a pandemic. On average, less than 1 alcohol beverage per day. And number 3, body mass index. That's your height and your weight in a calculation. You can Google it, BMI. Less than or equal to 25, normal weight. If a woman diagnosed with breast cancer follows those 3 things, stage for stage, she will live longer than someone who makes different choices as a breast cancer survivor.
Thank you, Dr. Irwin. And to kind of piggyback off that, we had a question in the chat from Maura. She asked, are there specific recommendations for BRCA1 breast cancer survivors? Is there different recommendations depending on whether you have the gene or not?
Absolutely. Thanks, Mara. So we know that BRCA1 and BRCA2 are associated with additional cancers to include ovarian cancer, pancreatic cancer, male prostate cancer to different degrees. We also know that it's hereditary, so that if one of your parents had it, there's a 50% chance of that gene being handed down to you. So we look at family trees to help make that diagnosis. Once people have the BRCA1 or BRCA2 gene mutation, we recommend a couple of very specific things. Number one, consideration of bilateral mastectomies, because we know the risk of a second breast cancer is much, much higher than the average breast cancer survivor. So to get ahead of it, to hopefully decrease the probability of a breast cancer occurring in the opposite breast. And then we ask at time of completion of childbearing, depending on the mutation between 40 and 45 based upon guidelines, to move forward with removal of both ovaries and both tubes. The fancy word for that is bilateral salpingo-oophorectomy. What it really means is that it's an elective surgery, generally done in a minimally invasive fashion by either gynecologic oncologist or your gynecologist, to take out the ovaries and the fallopian tubes so that they can't be future sites of cancer.
Thank you, Dr. Irwin. Denise, a question for you about kind of the social support. They ask, how could the social support of a fitness buddy help to motivate women with a cancer diagnosis to get moving?
Well, yeah, that's a really good question. I mean, I've done a lot of soul searching and found out that, like, for me anyway, like, accountability is a great motivator. And so just having somebody out there that you're being accountable for, whether it's a computer program or a friend. I am, I have a number of people in my network that I communicate with about fitness and running and biking. And there's so many tools out there that allow you to be in virtual workout rooms, when you can't be there in person. So I think that's, like, for me, it's like I said, first of all, there's a lot of tools out there that are on, the computer that will give you accountability. I use a couple of them that gives me accountability for nutrition as well as fitness. And then I have a group of individuals that I train with that I can link up with while I'm riding my bike and downstairs because of the software program. But I would, I think, like I said, a great motivator and great inspiration is having that accountability and having that workout buddy. Absolutely. Somebody who's going to call you up and say, time for our walk today. And you're like, ugh. For me, it's my dog. He looks at me and he's like, I think I'm ready for a walk now. And I'm like, okay, let's go. Yeah, it's your time. So he gives me some accountability. Even not a person can give you accountability if they're looking at you with those puppy eyes and saying, I think I need a walk. I'm like, okay, buddy, let's go for a walk. So yes.
That will help you get out there for sure. And what's great too, I mean, if we can't get with our fitness buddy in person, throw in some headphones, right? And just have a conversation with them. And what's so wonderful about our area is all the people that are giving back to the breast cancer community. We're here because of Stepsisters, and Stepsisters is there for you, there to help you with every need that, those everyday needs that you need help with. If you're going through treatment, things you shouldn't have to think about, paying the rent, paying the mortgage, getting groceries, cleaning your house. That's what Stepsisters is there to do. There's another organization called Too Unstoppable, and I know Michelle Stravitz, one of the founders, is on here. They have virtual classes for all of us, for cancer survivors and patients, and it's all free. It's free for everyone. They're there for inspiration. And it's also a way to maybe find a fitness buddy that's in your area that maybe you can just call and talk to on your walk. But to hold, at Denise's point, to have that accountability factor. So some great resources out there for all of us in our area. And that's what's so wonderful about being in this this type of support group. So thank you to both organizations for all that you do. Dr. Irwin, there was a question for you about alternative therapies. Do you ever recommend alternative therapies, i.e. Eastern medicine, etc., for your patients? If so, which ones do you feel provide the best results?
It's a great question, and it's one that comes up frequently. I think that alternative and complementary therapies are incredibly important and can be successfully integrated into standard treatments. And in fact, it was really groundbreaking at our International Breast Cancer Conference 2 years ago, the premier breast cancer conference in the world. One of the major podium presentations was about acupuncture. And it was with respect to the neuropathy, the numbness that comes with one of the chemotherapy agents. And it was a groundbreaking clinical trial because they really sought to take away all of the noise and prove that this works. So they actually had one group who had very skilled acupuncturists do real acupuncture. And they had the other group in the clinical trial get needles put in random spots that weren't true acupuncture. So both groups received a treatment, but only one received actual acupuncture. And both the patients and the physicians didn't know. Only the person who was administering the treatment knew which group the patient was randomized to. And they showed a statistically significant difference in the amount of neuropathy, and the only difference between those two groups was the use of acupuncture. So if that isn't definitive evidence that everybody already knew, right? Like, we knew this, but we've proved this. So that is one of the things that I encourage patients to do. Also, while on treatment, some people like to do cryotherapy, which is wearing cooling mitts or cooling booties to shunt the chemotherapy, to move the chemotherapy away from fingertips and toes as a way to decrease neuropathy. There's also excellent data for that, and that is a best practice recommendation to support any woman who wants to do it. In our office, we have scalp cooling. So one of the worst things about cancer is the hair, right? It's about identity, it's about privacy. You know, some women are fine with it. Other women, it's a thing. So we have the option for women to wear cold caps so that their scalp is kept at an even 65 degrees, so the chemotherapy does not attack the hair follicle. And on average, with these systems, 70% of women maintain 70% of their hair, which means that you'll notice it's thinned. Maybe your friend will, but an acquaintance, grocery store, someone you haven't seen in a while, you're going to be able to have that control over the disease. Now, one of the things that gets a little bit thornier in my experience and in my practice is in the use of supplements during chemotherapy. And I may or may not see some familiar names on this, and you'll well know my position. I believe that herbal products are molecules. My background is in chemistry. And whether that molecule comes from a plant, a leaf, a flower, or a pharmaceutical company, does that molecule fit the receptor, bind, and activate? In fact, one of our chemotherapies, Taxol, comes from the bark of the yew tree. So I get very nervous using alternative or complementary strategies during chemotherapy because we don't know about the drug-drug interactions between those products and our chemotherapy products. And in fact, it could lead to increased toxicity, more symptoms, or decreased efficacy, less bang for your buck for the chemotherapy. And as a final point to extend that thought, antioxidants have been proven in studies. High-dose vitamin supplementation while chemotherapy is going on has been proven in well-done studies to help the cancer survive. So during treatment, I'm a little bit more nervous about those. After chemo is done, I'm much more broad-minded about the alternative and complementary strategies. The NIH has a great website about this, and Memorial Sloan Kettering Cancer Center has a wonderful app and website. It's called About Herbs, and it really is a rigorous scientific look at these natural products so that a woman can make good individual choices for her own healthcare.
Really interesting, because you think it's all natural products, right? What's the harm it could do? But
so it's cyanide.
Yeah, to your point, you don't know what the interaction is going to be with the drug. Wow, great information, Dr. Irwin. I appreciate that. And kind of on that same topic, I got a question in the group chat. It says, I'm getting conflicting info about whether red meat or sugar contribute to cancer cell growth. Do you have any comment on that, Dr. Irwin?
Yeah, that's one of those internet myths. It starts in a kernel of truth, but then it builds a little bit beyond where our data is right now, and it gets a little oversimplified. at the beginning of my talk, I talked about good diet. In the middle, I talked about diet. At the end, I talked about diet. That cannot be underestimated. In fact, in my practice, Virginia Cancer Specialists, a few years ago, we took on dietitians to be incorporated as part of our treatment team because it's so important. So things like red meat should really be minimized. Fruits and vegetables, fiber should be maximized. Obviously, concentrated sweets are never a good idea, and certainly not a great idea while you're going through chemotherapy and you're trying to feel your best by fueling yourself well. However, there are these thoughts on the internet that the cancer disproportionately eats the sugar, and therefore you're feeding your cancer if you're having a high sugar diet. And that's not necessarily true. It's just that you're not fueling well your body. So if it's a birthday and you have a piece of birthday cake and you happen to be on chemo, it's fine. Don't worry about it. Just make other good choices throughout the day and week, and everything will come out in the wash.
Awesome. Great information there. If anybody else has any more questions, please send them in the chat. We've only got a couple more minutes left, so we want to make sure we get all of your questions answered. Denise, as an athlete, do you find certain foods that, I know everybody's different, but the certain foods or certain routine when it comes to eating and nutrition that gives you the most energy?
Well, I will tell you that I would be a poster child for Dr. Irwin's recommendations. So when it comes to nutrition, and I do acupuncture. So I'm a firm believer in acupuncture because I'm on a Taxol-based regimen. So neuropathy as a fitness person is like my biggest fear, you know. And so, you know, and I also, you know, was also informed about all of the supplements. And so some of the things that I was taking pre, you know, cancer treatment as part of like my training, I've actually backed off on. And so now it's been more of a, I would say more of a natural based diet. And, you know, I can tell exactly, you know, there are some things, there are food products out there are designated as inflammatories. You know, sugar is, you know, it's almost like a drug. Really, I mean, once you start eating sugar, it's kind of like all consuming. So, you know, there's also information that I read, you know, your body does need sugar, your brain needs sugar. So to go like totally without sugar may not also be a good thing. So I think, you know, just staying in a balanced nutrition plan of fueling your body appropriately, the appropriate number of times a day, like for me to fuel my body before a workout and fuel my body post-workout, but fuel it with good things, you know. Not if I have to rip open a bag, not so much, you know, kind of thing. So I think it is really important, and I found that, you know, that's really been able to maintain a very nice, stable foundation for me. But I also kind of agree that you can't. This life in general is not about perfection; it's about progress. And I kind of always rely on the 80-20 rule for any of my activities, whether it's fitness or nutrition. You know, 80% of the time, I'm going to be focused on what I can do, but there's always going to be that 20% of the time where a birthday will come up, or, you know, I'll be like, you know, during treatment, it's like the other night, not an advocate for this, but I needed French fries and ketchup. I have no idea why I needed that. But I got to tell you, that's what I ate for dinner because that's what I wanted. Because sometimes in treatment, you just eat what you feel like eating because the other option is you don't eat anything and you have to put some kind of fuel in your system. So that was my 20% rule of like not adhering to a fully nutrition plan of perfection. So progress, not perfection, for sure.
Oh, I love it. It's almost dinner time. You get me a little hungry there. Want to thank everybody for their questions. I'm going to ask our panelists to leave us with some final words of wisdom, if you don't mind, as we wrap this up. Thank you for answering all of these questions and being so open. And thanks to everybody for participating in this. Dr. Irwin, I want to start with you. Any final words that you want to leave with everybody?
I just want to thank everybody for this opportunity. This is my absolute favorite thing to talk about. So thanks for letting me geek out a little bit with all of you. And I hope to continue these conversations in the future. And again, I just can't express enough gratitude for things like stepsisters in our community, groups like Two Unstoppable. They make such a profound impact in people's lives, and we are just so fortunate to have them. So thank you.
Thank you, Dr. Irwin. We can tell your passion on it, and we love that you are so passionate about it. Nothing wrong with geeking out every now and then. We love somebody that is there to help us and to inform us. So we appreciate you and everything that you and your colleagues do. A reminder for stepsisters, this is October, they have their Step Up Challenge. It's not too late. If you're inspired after today and really looking for that motivation, you can still register on their website, stepsisters.org. Get your family to do it together. Get your fitness buddy to do it with you socially, and that will hold you accountable. You can put it on social, but come join us with Stepsisters and join the Step Up Challenge and start on that path to feeling great and looking good and being healthy. So it's really, really important to get moving, as we've heard today. Denise, I'm going to toss it over to you for any final words of inspiration, please, ma'am.
Yeah, well, thank you. And I think Dr. Irwin actually covered a lot of the gratitude that I have for both stepsisters and the other venues that are out there. And I'd like to thank her again for her, very, factual presentation. And I think both of our presentations kind of really focus on the fact of, like, there are things that are within your control. And as she said, it's diet, it's no alcohol, it's nutrition, it's, those are the things that you have a choice every day on that you can use to take care of yourself. And you right now, whether you're in treatment or post-treatment, you're your most important asset. So, reflect on those and saying, you know what, I can control this. I can control this. I can't control the treatment. I can't control the cancer. I can't control tomorrow whether it's going to come back again. But what I can control are those things that can make me healthier and more fit and just more focused on a more balanced way of life. So that would be kind of my takeaway is, to take a look at that. I think it's really important that you can do that. So thank you again. Thank you, stepsisters. I'll just close with a little bit of saying that this time with this diagnosis, the last time I kind of kept close hold. I actually am an endurance sport athlete, which means I do a lot of things by myself. But I will tell you, this time during this pandemic, I have accepted people with their willingness to want to help me, hopefully with some grace and gratitude, and not that, oh no, I got this. People want to help me. I'm like, absolutely. This time I'm like, accept the help, accept the village. They are there for you. Reach out to them. And sometimes you can be this really tough person. It's like, I don't need any help. You know what? I was that person. And I'm telling you, this time I'm like, bring on the help. I will take whatever help you can give me, any motivation, any inspiration, I will take it. So thank you for this opportunity to share my story and for everything that Stepsisters and other organizations like Two Unstoppable do for our community.
Denise, thank you so very much. And just a reminder for all of us, right, to reach out to our neighbors, reach out to our friends, just check in, as Denise said. Somebody may look like they're handling it fine on the outside, but sometimes it's just good to hear a familiar voice and say, hey, how are you feeling today? Do you need anything from the grocery store? I can drop it on your front step. We don't have to be close to each other. And be open to receiving the love and the generosity of others. It really, really makes a huge difference. But I mostly just invite all of you to reach out to somebody, especially somebody maybe that you know is going through treatment right now or has gone through treatment and is still kind of, moving along and figuring out how their new life is. So important, even if it's just a text message, 5 minutes or so. Thank you to Dr. Irwin. Thank you to Denise. Thank you to all of you, especially Stepsisters, for everything you do in our community. Thank you for having me today. I do want to say, I'm going to pass it over to Dario, but our panelists have expressed that if you have specific questions or you need to talk to somebody, that they're there for you. So go to stepsisters.org, reach out to the organization, and they'll get you in contact with our panelists, with any of us, if you need any help or advice or just a friend, right? We all need just a little friend every now and then. So thank you for having me, Dario. I'm going to send it back over to you.
Thank you, Kristen, and really just thank you to everybody. I'm honored to have been play a small part in this event today. Thank you to Kristen, Denise, and Dr. Irwin. Clearly, Dr. Irwin is really passionate about what she does, and Kristen and Denise, you guys are inspiring. Plus, the other survivors and people that are actively in treatment on the call, just really, really powerful stuff. We hope everybody checks out the stepsisters.org website and the step challenge that's going on right now. And I will say, even in treatment, Denise is at the top of the leaderboard, so she's a tough cookie. I'm trying to keep up with her, and just really, really inspiring stuff. So thank you so much. This will be available as a recording, so stay tuned and look out for that too. So thank you very much, and we'll wrap it up. Bye.
Bye-bye.
Bye, everybody.
Bye. Thank you.
Thank you.